with that, we are moving to the first proceeding, that would be the keynote address. All right, for the keynote address, I would like to have one special personality onto the dais. We have Dr. OSAMA Al-HASAN, who is the head eHealth Dubai Health Authority, and he will be speaking on eHealth implementation in UAE, which is basically deals with a case study. So ladies and gentlemen, let's have a huge round of applause, and let's have the keynote speaker of day 2 of 20th MEDRECON National Conference. Here we have Dr. OSAMA Al-HASAN.
My name is OSAMA Al-HASAN. I'm coming from Dubai. Actually, the title has changed several times because there's a misalignment between what's written in the notes of the conference and what I was planning to develop. So mainly to be about implementation and about eHealth workforce. Is it better here? So this is the agenda for today. Yeah, I got it. So let's get to the agenda. So I'll talk about myself a little bit, so what's on in the UAE, and then I will talk about the core of the talk, which will be around eHealth workforce. So I'm a software engineer by training. I got a PhD in software engineering from University of Leicester, UK. I have almost 10 years of experience in health informatics roles. I'm now currently specialist at Health Informatics and Smart Health Department at Dubai Health Authority. I'm also a board member of International Society of Telehealth. And I'm also coordinator of the GCC eHealth Workforce Development, which is called ZIMAM. Most of the talk will be around ZIMAM activities. So before we start, just seeing what's happening in the UAE. So UAE now is trying to become one of the leading countries within the digital healthcare. We are focused, we have a lot of, we have a lot of initiatives coming from the top leadership in the UAE. So we're talking about the UAE Vision 2021, UAE National Innovation Strategy, UAE Strategy of AI, and also we have Dubai Future Foundation, which is trying to let Dubai to become a hub for digital healthcare innovation. So what's happening now that our leadership has a very, very big vision that we are working as executive in the government trying to catch up with this vision. And the challenge with what we have in healthcare, that healthcare is more difficult to adopt technology and innovation in healthcare comparing with other sectors. So see, like Dubai Police is trying in one day to augment robotics in their work, but doing the same in healthcare is a long journey. You need to do a lot of, because we are dealing with human life, so we cannot adopt technology as is. Also, we know that our doctors are really busy with their work. They don't have time to focus on technologies, adopting technology. It's not easy to take them out from their surgery room to test AI algorithm, for example. It's not easy. So this is the main challenge that we have as a healthcare ecosystem. So speaking in a nutshell about the UAE healthcare, so we're trying to be a world-class healthcare through collaboration between public and private, developing accreditation. So for example, now GCI is a must for every hospital in UAE. So we're trying as much as possible to attain to those kind of accreditation programs. We focus on preventive medicine. This is now the trend. Reduction of cancer and lifestyle diseases is our top priority. With regard to KPIs, now we are ranked 28th in the Health Quality Index in 2016, and average life expectancy is 86 years. What I like really about our government that we are really responsive. That means when we get a new idea that we need to push, it doesn't take much time. So just one example of that, in 2013, we had what we call the ministerial retreat. So the whole cabinet, the prime minister, they set one day to receive ideas from public on healthcare. And one of the ideas that were put forward during that day is, why don't we have a unified medical record across UAE? This happened December 2013. The cabinet liked the idea, they put it in their agenda. In 2015, after doing the full study, this was converted to a ministerial decision on that Ministry of Health has to implement this project as soon as possible. In 2016, as we are Dubai, launched what we call NABIT project, which is the HIE for Dubai, that will, in very recent time, will be integrated with the Ministry of Health, HI. So this is just an example of the time span of a project starting from an idea to execution. So now I will focus on the MAM project. So the MAM is kind of an NGO initiative that started in 2016. It's a GCC level initiative. It focuses on one thing, eHealth workforce development, because we think that the biggest challenge that we have in our region is not bringing technologies. It's really having the right talents to utilize these technologies to the most. This is the real challenge. So I will, before I start talking about the eHealth workforce development, Imam, I would like to share with you a story that actually inspired me to start this journey. So in 2014-15, we started in DHA, Dubai Health Authority, we decided to implement EPIC. EPIC is a top-notch electronic medical record in the world. And bringing EPIC to Dubai or to DHA, it requires a lot of investment. It's very expensive solution. And it's also people-intensive solution. It's not just a box that you plug and it works. You need to train your people, your team, to be able to utilize it. So I remember that when the management decided to select the team for the project, many people were not interested, even to work on this. So everyone was asking, what's in it for me to take time of my busy schedule and focus on technology and understanding technology? What's in it for me? Because the issue is that we don't have career path for technology. Even if I'm a doctor, I'm a busy one, and they ask me to be a champion in this project, I will not get anything out of it. So unfortunately, I realized that during that day when they did the selection, that almost, even we're talking about local people, less than 10% of the selected team were Emiratis. Because they were not interested, simply. So I thought that it's just an awareness problem. Someone has to move on, step in, and try to push, not the Emiratis, the government, to bring incentive for people to be interested. Because this is really a job for future. They have to realize it. So this is the idea behind the project. So we started as a non-government organization. It's still under registration. We started with around 12 people. Most of them were from academia, working in health informatics, health information management in the university. Some of them were officials in healthcare organizations. So we started our first meeting in 2016 saying, yes, we need to bring government, we need to bring education institutes, we need to bring government initiatives that targets young talents. We need to also to address organizations like HIMS, IFHIMA, IFHIMA, those who have certification programs, to work together to come up with a unified initiative that supports specifically GCC talents to step into this journey. So these are the names, people who started the first project. If you see, most of them are from academia or from business, vendors, are some of them are coming from universities. Some of them are well known in their career. So later on, we received even more supporters. Some of them now are taking very high leadership position in GCC countries. So for example, like Dr. Ahmed Belkhair now is the Undersecretary of eHealth in Saudi Arabia, which is a very important role now. So what is the, very confusing. So what's the vision and mission of ZIMAM? So the vision of ZIMAM is a sustainable digital healthcare ecosystem in which local eHealth workforce is empowered and taking the lead. This is the vision. And how we can realize that is to improve eHealth skills and competencies of national human resources in the fields of health information management, health information technology, health informatics, through two ways: continuous training, even in the job training, plus, and this is even more important, developing career path for young talents through the system. So they started as graduates, and then they will know that there will be a very clear career path for them to develop, to get better positions, to get better income, and so on. So how can we do this? So first, we need to focus on recognition and partnerships. Then we do a survey to understand what's happening in the market. Then we develop a competency-based framework. And finally, to have a knowledge-driven eHealth ecosystem. So we started with activities because we think that this is the best way to increase the awareness about the problem and how to solve it. So we started with, in 2018, with the GCC eHealth Workforce Development Conference that happens in 2018. It was really successful. And we developed it again in 2019. It was like 3 months ago. And I'll speak about it in just 2 or 3 minutes. So in 2019, was really successful. We had like around 400 participants from all GCC countries, and we have very strong support from the main healthcare organization focusing on training. So we have representatives from IFHIMA, from EMEA, American Medical Informatics Association, IFHIMA, American Medical Health Information Association in America. We have the Australia HISA, the Health Information Society of Australia, and it was really, really successful. The most important activity that we have during that event, it was the competency-based eHealth Career Path workshop. This workshop was phenomenal. So in this workshop, we had almost 40 participants representing 25 countries, 5 continents, thinking about one issue: how to develop 6 career paths under eHealth. Apart from those 40, among those 40 participants, we got the CEO of EMEA, the American Medical Informatics Association. We got the CEO of the IFHIMA, American Health Information Management Society. We got the CEO of the Australian Health Informatics Society. And also we got this, the CMO of HIMS. And they all agreed that this is the right way to move, to develop 6 career pathways. So when I'm talking about career path, that means is starting from an entry level, from a university degree, and then through the way, in every promotion, you need to have prerequisites. And these prerequisites constitute of what we call a job file or a profile that shows how many projects that you have done through the 2-3 years. The certification, which I'm talking about, the relevant certifications or to this career path. And maybe sometimes you need to have additional, what I call them, like university degrees. It could be a master degree or a PhD or whatever. Combination of those 3 will allow you to be promoted to a better job. So we developed this for health informatics, medical informatics, health information management, security and privacy, RCM. Those are the main focuses of the career path. And the results of this workshop will come through a research paper that will come within 2 or 3 months from now based on a qualitative study developed during this workshop. It was a full-day workshop. So I talk also about the survey, so I want to just move very quickly about what we have done through the survey. It started in January to March 2019. So those are the participants in the survey. We developed the survey in the support of an expert from Germany with 2 locals who really developed the survey contents. And then we had to have an ambassador in every GCC country to make sure that the survey reached to the right people and we harvest as much as responses to this survey. So I'll talk a little bit about the survey. So the survey designed to measure through opinion attitudes of members of GCC and global healthcare community regarding eHealth workforce skills, training status. We got more than 600 responses across GCC. I'm talking about the relevant responses. Most of the responses came from UAE, Oman, and Saudi. If you see the granularity of the responses coming from those countries based on the role of the respondees. So we have, for example, 98 were clinicians, and we have also 98 who are responses coming from administrative roles, and the others came from educators, engineers, IT. So the granularity was really, really good. Large majority of clinician and administrative healthcare workers responses, like 88%, stated that the current work or position requires utilizing eHealth. So 88% of the respondees agreed that digital healthcare is becoming now part of their job. There are also some numbers about training have been given matched. That the majority, 55%, believe that training that they have been given matches the work. So the question was about, does they have a training that matches their job description? So it's almost 55% only say that it matches their needs. Let me check. There's one interesting number here that we have. Yes, so in terms of responsibility of their education, and this is a very key question here. So we realized that we asked a very important question. You as a medical practitioner or someone who's working in the medical field, do you pay for your training or your organization pays for it? And this is a very key question. So we discovered that most of the time we pay for our training. Our organization won't believe in it and they won't even sometimes reimburse for it. And this is one of the challenges that we have in GCC. We don't focus much on training. We think that we hire the right people for the right job, and that's it. And this is one of the challenges that we have with workforce development, that we don't focus much on training. This is a bit complex diagram that shows the deviation between our intentions as employees. So I like HIIMA certification, but this is I understand that HIIMA coding certification is very important for my career. But does this person really strive for it? Did he try to achieve it or not? So this is the gap between my intention and my actual. So we realized from this diagram is certified coding is the most achieved kind of certification comparing with other certifications. So I'm talking about medical coding. The gap between the intention and the practice of achieving the certification is minimal comparing with the others. It shows that the medical coding is more popular to strive for. And comparing, for example, with EMEA or with something like EMEA training, some people, they don't even understand the importance of EMEA training. So the good news that medical coding still is kind of popular in the domain. Also, one of the key questions that we got, or the key takeaways that we got from the survey, is the mentorship part. So although that almost 80% of the respondees said that mentorship is very important to my career, almost 40% said they've never have a mentor in their organization. And this is one of the key issues that we have to do. Yes, maybe we can get experts and they are working in our organization, but actually they are not transferring knowledge in the right way or in a systematic way to our young talents. And this is one of the key issues that we have in our region that we need to tackle. So mentorship is a key issue. Paying for training within organization, continuous training within organization are very important to develop our workforce. Before I stop, I will take maybe 2-3 minutes talking about the new trends in eHealth that can even apply for our students who are coming to the market very soon. They need to learn about them. So what's happening today, that there's a big shift today from what we call physician-oriented healthcare ecosystem, where everything controlled by physician. The physician who writes my prescription, who will decide what's going to happen to my health, and patients are almost passive to this. Now we are moving to a patient-centric domain where patients are participants in their care process, and sometimes they take decisions independently. So because of that, we see like more focus even in technology about consumer health, about data analytics that support patient, about telehealth. So now the patient will decide whether to go to the doctor in his hospital or stay at home and connect through technology. So now we are empowering patients more and more, and this will get us into new types of jobs, new types of way of dealing with healthcare data. And we, as I won't say medical coders, I would say health information management graduates, should be ready for those changes that are happening in the market. So we are seeing things happening, getting top technologies affecting our healthcare as based at NHS report. We're talking about telemedicine, smartphone apps, sensors, reading the genomes. So these are the new technologies coming to the market. But what will be the impact of this kind of technology, this ways of the shift of the paradigm of healthcare? What will be the impact on the job market? So what we are seeing now, even now in the US, is already starting. We are seeing new types of jobs that I think HIIM professionals, and this will not happen without a profound change in the curriculums of schools. And because of that, I say always, universities should be part of this kind of initiative. They have to understand what's happening in the market and apply these new required knowledge to their curriculums. Otherwise, you will not have prepared workforce. So we are seeing now things, so even medical coding as a practice will change gradually to be augmented with AI. So I'm an HIM or a medical coach should be ready for that. Maybe not as an inventor of AI algorithm, but at least someone who can interact with AI algorithms. Patient privacy officers. This is the kind of a new jobs that even in UAE now, we are advertising for. And so mostly it should be someone who have, I can say, health information management background with information governance. These two combinations will create a privacy officer. So we need to have one step further now through information governance within HIM curriculum. Patient transition transfer. This is our transfer officers. This is also a new type of job. So if a patient is moving from facility 1 to facility 2, I'm talking about patient with comorbidities, with long history, taking his file from this institute to the other one is a very core activity. It requires someone who knows how to take files or take information from several resources and augment them in a way that can be comprehended by the new facility. So this kind of a new job happening after what we develop now, which is the health information exchange. So now moving the data from facility to another requires some sort of monitoring or auditing or whatever. So this is kind of new roles that coming to the market. Population health. So population health specialist at level of value-based care or at level of registries is also in high demand these days. Digital clinical trials. This is also a new trend happening in the US. So now we are not waiting for the doctor to tell us how the patient feels. So now there are new technologies through smart mobile phones that allow patients to talk about their feeling, their experience. So we are talking about patient-reported outcomes. We are talking about patient-reported experience measures. These kinds of tools also requires health information management experts to make this process very smooth. And finally, artificial intelligence ethics. So today, if we are trying as a company, and we are trying to develop an AI algorithm based on healthcare data, we need in our team experts in health information ethics, which is also related to health information governance. And mostly, those should be HIIM graduates. So these are the kind of jobs that we will see in the market starting from today up to the next 5 years. And I think that's the final slide. So before I leave, I want to invite you all to attend the third eHealth Workforce Development Conference that will happen in Dubai between October 31st and November 2nd. And before I leave, I will leave you with a video. I don't know if it's going to open here. Okay.